In this recording, we will briefly mention several common central nervous system disorders. First, we could suffer from an infection, perhaps meningitis, which can be either viral or bacterial. Either way, this results in the inflammation of the membranes that surround the brain or the spinal cord. So if you remember back to our discussion of the dura mater, the pia mater, the arachnoid mater, that's where we are talking about. Okay, so those can be inflamed and lead to problems with the central nervous system. We could have some sort of damage to the brain or spinal cord. So general paralysis is caused by loss of motor function. This could be due to a stroke, trauma, like physical trauma, perhaps spina bifida, which we'll talk about a little bit later, or even botulism. And then there are subsequent categories or types of paralysis. So we have flaccid paralysis. When someone suffers from flaccid paralysis, then the motor neurons that directly serve particular skeletal muscles have been damaged, which would result in no activity. These muscles would no longer be able to contract, and this would also result in muscle tone loss as well. If you suffer from perhaps a broken neck or polio, or even again botulism, that could result in flaccid paralysis. All right, spastic paralysis. This one's really a disorder that causes the muscles to tighten and contract in a spastic manner. Okay, so just kind of sporadically, you have muscle contraction, muscle tightening, and then kind of go back to relaxation. That one's kind of interesting. Paresthesia is the first one we've really mentioned that's not involved in movement. This one is sensory loss. This one can be temporary or it can be chronic. If it is temporary, then you have probably put excess pressure on a particular nerve and it results in that pins and needles feeling. So a lot of times people will describe this and they'll say things like, oh, my leg's asleep, my foot's asleep, my arm's asleep, something like that. If your limb has ever quote unquote fallen asleep, this is actually what's happening. That's that pins and needles feeling. If you relieve the pressure of the nerve, then eventually that sensory feeling will come back. Now, this could also be long-term. We said this could be chronic. If it's chronic, it's probably associated with something along the lines of peripheral vascular disease, diabetes, carpal tunnel syndrome, even cerebral palsy. Okay. Now, paraplegia results from an injury that occurs somewhere between the T1 and the L1 vertebra. You've damaged a spinal cord somewhere. This results in lower limb paralysis. Okay. In addition to perhaps a spinal cord injury, you could also suffer from spina bifida. Okay. We've seen that term a couple of times. We are going to go into a little bit more detail about that later. Okay. All right, quadriplegia. Okay, again, we've damaged our spinal cord somewhere. This results from loss of limbs and torso movements due to either illness or injury. You have basically damaged your spinal cord somewhere in the cervical region. Okay, and depending on where you have damaged your spinal cord will depend on how much function you have lost. Okay, there are varying degrees of movement that you could or could not still experience. So sometimes people that suffer from quadriplegia could maybe move their fingers just a little bit to move like a little controller. If you've ever seen somebody in a wheelchair and they're just kind of moving it with their fingers, they could maybe suffer from quadriplegia, something like that. You could also experience autonomic function loss. Okay, so sometimes people have to be on breathing machines all the time. A lot of times they are no longer able to control like their bowel movements, things like that. Those autonomic functions that we kind of take for granted are usually affected. This could result from things like a fall, a really bad sports injury, a car crash, things like that. Now, spinal shock is a temporary loss of function due to a spinal cord injury. This one is most commonly associated with whiplash Whiplash is usually associated with something like a car crash. Okay, again, this is technically just temporary. Okay, so once your body has time to heal, you should regain full function. All right, we could suffer from some sort of developmental disorder. So cerebral palsy is a group of disorders, and collectively there is some problem with the voluntary muscle movement of the body. This can occur before, during, or after birth, and these could be caused by quite a few different conditions. Lack of oxygen at or around birth, a viral infection, excessive smoking by an expected mother, exposure to radiation, drugs, alcohol. Okay, any of those things before, during, and after birth could lead to some form of cerebral palsy. And this does, well, there is different severities of cerebral palsy. Sometimes people suffer from just really mild cases, but sometimes this can be quite severe. Now, spina bifida, we have thrown around that term quite a few times. What spina bifida is, you are, well, if you suffer from spina bifida, you are suffering from a condition where your vertebral arches have not completely formed, and so your spinal cord is not completely encased within your vertebral column like it is supposed to be. So it kind of sticks out in places that it is not supposed to stick out. This is usually linked to low deficiency or lack of folic acid during fetal development. Now, folic acid is a type of vitamin B that is required for proper fetal development. This can also lead to like hydrocephaly, so having too much cerebrospinal fluid on the brain. We've talked about hydrocephaly before. Okay. Again, there are varying degrees of spina bifida. Okay, so some mild to moderate cases, and then there are some very severe cases as well. Now, anencephaly results from basically little to no development of the cerebrum and or other parts of the brain, including the brain stem. One of the causes could potentially be spina bifida. Okay, so this would also obviously be a very severe form of spina bifida. We can screen for this during a pregnancy. They look for the presence of alpha-fetoprotein, okay, which also kind of gives them a clue as to if the fetus could potentially suffer from spina bifida and or the anencephaly. Unfortunately, death occurs within hours or maybe a day or two from birth. You know, if you don't have much of a cerebrum, if you don't really have a developed brain stem, it's really just not compatible with life, unfortunately. All right, last category, we have pathologies. So things could just kind of go wrong later. So stroke, also known as a cerebral vascular accident, or CVA. Okay, this results from things like blood clots, or hemorrhages, or edema or swelling in the brain. Doesn't really matter which one's causing it. What is happening is that you are cutting off oxygen, okay, to your brain cells, which causes them to die. This could result in some sort of paralysis as well, depending on what region of the brain has been damaged. This could also result in some sort of aphasia, depending on what region of the brain has been damaged. Again, there are different severities, okay, of stroke. Some people, they suffer a stroke and it just kills them. The oxygen is not getting to enough of their brain and it just ultimately kills them. Sometimes patients do suffer from some sort of paralysis, sometimes the aphasia, again, not being able to really speak anymore. Sometimes you can have a partial recovery. There's just lots of options there. All right, concussions are mild brain traumas, but contusions are severe brain traumas that can lead to coma, and everybody knows that comas are not very good. Media and society kind of makes concussions out to be like these really big bad brain traumas. Technically they're mild, but it's almost always in the context of like athletes suffering from concussions, And really, it's the idea that repeated concussions can lead to like brain damage and things like that. And last but not least, we have cerebral edema. This results from swelling of the brain due to some sort of direct trauma to the brain. Anytime you either swell your brain or swell like the meninges around the brain, anytime we have that intracranial pressure increase, we run the risk of losing function either temporarily or permanently.